So the Phase II MorningSun study is actually a basket study with many different expansion cohorts. The one that I presented is this interim analysis from a Phase II expansion cohort in patients with newly diagnosed untreated follicular lymphoma. They all have to have high tumor burden per GALP criteria. And all these patients actually enrolled from 55 different sites in the United States, but 45 or 55 are community sites. So most of these are really with the aim to recruit patients from the community sites. So in this study, Mosunetuzumab was a CD20 CD3 bispecific antibody that was given subcutaneously as a monotherapy. And there's a dose step-up dosing in cycle 1, but from cycle 2 and on, it's one dose every 3 weeks, so it's pretty convenient. And steroids as pre-medication, also as a way to mitigate second release syndrome, was only given in the first cycles and cycle 2, so only for 4 doses. And other subsequent doses, there's no need for steroids. So what we have seen with all these patients, a total of 102 of them treated, the overall response rate is 87%. And complete response rate was seen in 61% of these patients. When we look at the progression-free survival, the median progression-free survival was not reached. 12 months progression-free survival was 83%. So it's quite encouraging. When we look at the safety profile, the most common side effect is really injection site reaction, which is low grade or resolved. And the one that are of interest is second release syndrome, which is also pretty much match what we're seeing with using mosunetuzumab in a subcutaneous fashion in a relapse refractory setting. The total CRS rate is 34%, but most are grade 1 and some are grade 2. There's no grade 3 or above CRS. And all CRS except one case occurred during cycle 1 and all resolved. So therefore, this is a first expansion phase 2 study looking at mosunetuzumab subcutaneous injection in patients with untreated follicular lymphoma patients who needed treatment per GALP criteria. And we see very encouraging efficacy using this single dose. And also we see a very manageable side effect profile. And this is also given in the outpatient setting. So further study really looking at giving this in a more expanded cohort with a focus in community setting really warrants further study.